PathMonk is the AI for website conversions. With increasing online competition, over 98% of website visitors don't convert. The ability to successfully show your value proposition and support visitors in the buying journey separates you from the competition online. PathMonk qualifies and converts leads on your website by figuring out where they are in the buying journey and influencing them in key decision moments with relevant micro experiences like case studies, intro videos, and much more. Stay relevant to your visitors and increase conversions by 50% by adding Pathmon to your website in seconds, by letting the AI do all the work, and increase conversions while you keep doing marketing as usual. Check us out on pathmon.com. All right, everybody, welcome to today's episode of Pathmon Presents. Today, we are joined by Eliza Freer. She's the Director of Marketing at Remmie Health. Eliza, welcome to the show.
Thank you.
So I would love to, just get to the basics, Eliza. Maybe if you can talk about Remmie Health a little bit and explain to us what's the big idea behind your company. And, an analogy we typically say is just, if you were to explain it to a friend over coffee, how would you describe what you do?
Remmie Health is a med tech company. We make digital otoscopes for at-home and clinic use, but our primary goal is at-home use. So an otoscope is the thing that a doctor uses to look inside your ear, your nose, or your throat. It's just a little handheld device with a pointy tip on the end. And so we make ours digitally because the devices currently used inside a doctor's office are all just eyeballs. There aren't cameras inside there. So the thesis behind the company, our founder had a son that had chronic ear infections. And she was in the ER constantly with him in the middle of the night and in opportune times. And she thought there had to be a better way to see inside the ear and understand what was going on than an ER or urgent care visit. I mean, not only can they be fiscally complicated for families, especially families with multiple children, but families that live in a rural area have a harder time getting into, a facility like an ER or an urgent care. So she developed this device that has an HD camera on the end of it, and it's compatible with our app and with your camera roll on your phone, laptop, or tablet. And it allows you to not only see inside the ear, nose, or throat, but to take photo and video. And then through our app, you're able to communicate with physicians or telehealth providers and provide them with further information to help with diagnosis, to send them the photos that are in-person quality. So that way a physician, someone like a telehealth clinician, is able to diagnose from a distance instead of you always having to go into an ER.
That's powerful. Okay, I only knew what that meant just because my son recently went through a visit like that, and I mean, just having the idea of having a device like that at home, and now, I'm lucky enough to be close to a hospital. That's not being an inconvenience for me. But what you just said, it sounds like a huge game changer. And I want to touch on a second, for let's talking about marketing lingo, your ICP, right? So
Yeah.
who's the is it the mom or the parent, generally speaking, that's more interested in this? Do doctors look into it? Like, can you give us a glimpse into, who's your product for, basically?
Right. It's interesting. We have a lot of physicians that are, clinicians, direct primary care physicians, or, primary care physicians even, because there's a difference between DCP and PCP. And they are really interested in being able to provide the device to their patients to take home with them. So then they can take the photos and videos, they can connect through telehealth with their patients and cut down on their patients having to go to the ER because it's inconvenient. It provides some negative emotions when it comes to dealing with, a medical community. and they want to be able to provide their patients with the best care possible. And having a device like this at home where they can send photos or videos when they're concerned, even if their physician isn't available, but they have the device to immediately make a telehealth appointment and they can show the images to a telehealth clinician. They are very interested in doing whatever they can to help their patients have a better experience. And then as far as commercially, moms typically are the ones who are searching for this kind of device, since they tend to be the ones that, would take the child to the ER. However, because this isn't a, you can also use this device with adults, there is the capability to check out your nose, see if you have a sinus infection. My brother had chronic sinus infections in high school. And if we would have been able to use something like this and see, like, oh, okay, it doesn't look like a sinus infection, then we wouldn't be so concerned about having to get him into the hospital and get a, Z-Pack and make sure that he's taken care of. It could just be, oh, this is a standard cold. So aspects like that also are helpful as you continue to age, and not just for children who are more prone to ear infections.
That's interesting. So that, that would have been helpful for my wife too. She had the same thing and she had to undergo surgery for it eventually, but it was such a long process because, the
Yeah.
appointments were months apart and, that sounds like a game changer for adults too. I didn't know, I didn't realize, but that makes a lot of sense, right? You want to check something, then you have the device at hand to be able to do that. So
Mhm.
that's awesome. How do most people discover you then? Is it, would they just look for something particular on Google or, word of mouth? Physicians, as you said, might recommend or give the product to families or, whoever is interested in it. How does that work?
We get a lot of word of mouth from physicians who recommend devices to their patients. We also have events where we go out in the community and we explain the device to them so they can actually see it working. So that helps to spread awareness. We have, an Amazon store, which is where a lot of people search for things like this. They go to Amazon and they type in ear camera because they don't know what an otoscope is. I mean,
Hmm.
why would you if you're not in the medical community? So they can go onto Google or Amazon and search for ear cameras, and then we'll pop up and we have a better quality than other competitors you might see. And while their price point could be cheaper, the device is a little, lesser quality as well. Our cameras can video stream, they are HD, they can take all kinds of photos, and while our app is usable with photos from other devices, sometimes the quality that comes from other devices just isn't as good. So I'll say a lot of people, when they go online, a lot of times they go in kind of with a panic and looking for an ear camera or looking for a diagnostic device. And while we ourselves don't diagnose, we are an aid to diagnosis. So it's an interesting middle ground where we're mentioned as clinical grade by physicians. And then on the consumer end, we're sort of the let's break it down in keywords that will be your panic Google to get something to help
Right.
your kid.
Yeah, that makes a lot of sense. As a segue, I'm curious about obviously word of mouth is a big one, right? That's the oldest, I guess, referral in a way.
Yeah.
But in terms of your website, how much does a website play in role in pulling in new customers for you guys? And maybe if you could expand a little bit on whether there's something that really works for you at the moment or anything that maybe you got your eye on improving.
I'll say our website is a great informational tool. We have a lot of FAQs and tutorial videos provided there. So we make sure a patient or a clinician knows how to use the device properly. So if even if it's like, oh, I don't understand how to plug this into my phone, we have a video for that that's just a shorter snippet of the longer video. We have videos that just help the patient understand where the images are going to be saved. If a clinician is curious about having the information to inform their patient about where to gather these images, they can watch the same videos that their patients watch, because our device, while it is medical grade, is the same usage wise for a physician or a consumer. So we have a lot of informational heavy pieces that also help you understand how our device is different than other devices. And we have some blogs that help to explain not only our company, but what's important about understanding what an ear infection is. And we're very careful to not be a medical diagnosis company. We're not going to tell you this is what this is, but we are going to give you some key indicators of an ear infection and say this is what it could be, so they know what they're looking at. We break down a lot of the terms that physicians and clinicians might use if it's like they're big medical jargon you don't understand. We break it down on the website. So it's like, this just means ear infection. So don't panic. It may sound scary. It's not scary. It's just an ear infection. Um,
Right.
and so that's really helpful. So informationally, we have a lot of great materials, and we sell our devices on our website as well. So preferably, we want people to go to our website so they can learn about the devices, learn about conditions, as well as purchase our devices there, where Amazon is very handy and convenient, but you don't receive all of the information that you would receive on our website. And
Right.
then the struggle, I think, is unless you know the question you're looking for, or unless you're already interested in a service or information we provide, we're not necessarily something you would look for just as something to search on a Saturday night. So I'll say the struggle that we continue to have is being a niche product inside a niche market. And you come to us if we can help. But if you don't need the help, you won't come to us.
Hmm.
So that's really our struggle.
Okay. That's fair enough. You mentioned blog posts, informational pieces, anything that someone can use potentially to get informed and then make a decision, right? And I'm sure you have had a hand in all of that sorcery. So could you maybe expand a little bit on, what's a day in the life? I want to switch gears for a second here,
Sure.
Eliza. Talk about, you as a leader. Can you expand maybe a little bit on, okay, what do you do on a daily basis? Do you, there's there copy involved? Is there, typically a director of marketing will do a bit of everything
Yeah.
and have their hands on all kinds of things. So yeah, what's a day in the life of Eliza, and what do you focus on a day to day?
I'll say that we're a small company. So at any given time, I could be discussing market research and questions to give to clinicians if they are speaking to patients. I could be giving some insights into questions I've heard from the community or concerns I've heard from the community that are great to ask people that are a part of our medical trials. I could also be grabbing photos from LinkedIn from an event we were at and creating a social media post, writing some quick copy and tossing that up. I could be handling a marketing dashboard report where I look into all of our paid social and organic channels and figure out what works and what doesn't. Um, I could be helping with our Amazon store. I could be having a meeting and making sure our team is happy and that their needs are being met. Or, assisting somebody or having them assist me in better understanding what pieces of material should go on our website. So sometimes it's conferences, sometimes I'm at a conference, sometimes I'm prepping a conference, sometimes I'm giving a tutorial to a doctor. So it sort of just changes day to day. I do my best to try and lump them into pieces. Like today, I'm going to do the social media calendar, and then tomorrow, I'm going to write some copy, and then the next day, I'm going to create the images. So that way I just have things in one file that I can easily pop in and out so that I'm not at the last minute having to create things. And I've had to put very strict rules around that for everyone else because it can be complicated to know how much time something takes. And if I'm
Mm.
creating a video and getting it edited, then it's like this isn't going to be done overnight. This might take me a few weeks. And so timelines can be a difficult thing to explain and understand as well if you're not constantly dealing with the material and the needs of demand.
Yeah, absolutely. Uh, as I predicted, you wear so many different hats. Uh, Speaking about timelines, let's, I want to wrap things up, Eliza. We're coming towards the end of our time here. So I want to just jump into a rapid fire segment. And the only rule we have is that, for a concise question, we expect a concise answer, right? So they'll be quick and easy, light and engaging. Are you ready for it?
Sure.
All right. So do you prefer watching, reading, or listening?
Reading.
Okay. What's the latest article, book, whatever piece of content that you read that you picked up, and were there any gems or ideas that's really stuck with you?
An article about swimmer's ear and how helpful our device can be for something as simple as that to be able to see if maybe that's what's up with your kid, since that's very common in the summer.
Okay. If you had a magic wand and could fix one frustrating thing in your marketing life with tech, what would it be?
Copywriting.
Good one. What's one repetitive task that you love to put on autopilot forever?
Meetings.
I love it. Okay. So if you could go back and give your past self a quick pep talk at the start of your marketing journey, what's the one single advice that you would drop?
Asking for help or accepting it isn't a weakness.
Amazing piece
There's
of wisdom.
Thank you. There's a lot of an idea behind if you can't handle everything, then you look weak or you look as though you can't do a big job. And,
Yeah.
my own experience, especially as a lady in business, is we feel as though if we accept help, then people aren't going to have faith in us. And that is something I continue to struggle with when I can delegate things to a team member and it's like, yeah, no, but I can handle it. So that would be my biggest piece.
Yeah, no, that's a good one, and it's nonsense, because it shows willingness to learn and being aware of your even limits at times, right? When you delegate and things like that. So I think it's a really good one. Eliza, I want to thank you for being on the show with us today, and also want to give you the last word. So if someone forgets everything about the interview today, what is the one thing that they should remember about the work you guys are doing?
ENT health affects everyone, not just kids. But also sometimes the devices are fun just to look and see how much earwax you have. So it doesn't have to be serious. Sometimes you can use medical devices for fun purposes as well.
Got it. Well, Eliza, as I said, thanks again for joining us on Pathmark Presents. And where should we send people if they're interested? If they need your product potentially.
So if you go to our website, remmiehealth.com, and Remmie is Remmie health.com, we have user portals and clinician portals that can answer different kinds of questions that people might have and information about our devices where you can shop or just learn.
Perfect. Eliza, as I said, thanks again. And who knows, maybe we get a chance to talk again before the year ends. But yeah, it was an awesome conversation. I appreciate you for it.
I love that. Thank you, Rick.
All right. Bye, everyone.